Hello, everyone. It's an honor for me to be part of this 30th annual BC Lupus Society Symposium and share with you my research on experiences with mental health among individuals with lupus during the COVID-19 pandemic. I am broadcasting from my home in Vancouver, so I want to take pause to acknowledge that I am on the unceded territories of the Musqueam, Squamish, and Tsleil-Waututh nations. And I invite you all, wherever you are, to take pause to recognize and acknowledge the land and the people where you are at. So I'm an associate professor at UBC and a research scientist at Arthritis Research Canada. As an epidemiologist, my research focuses on managing and living with chronic disease. So I have done quite a bit of work in lupus, including looking at medications in pregnancy, as well as medication adherence, which is taking medications as prescribed. I am proud to be a longtime friend of the BC Lupus Society, and because we couldn't physically be together for the symposium, I pulled out some oldie but goodie pics from previous events like the BC Lupus Gala in 2015, where the baby in the belly is now the little girl holding the orange balloon at the BC Lupus Walk in 2018. I think I share with everyone this same hope for the end of this COVID-19 pandemic and look for the opportunity to one day be together again. So, which leads me to the topic of the research that I'm presenting. I think it goes without saying that the COVID-19 pandemic has profoundly impacted all of us and all aspects of life. So if you look at websites on COVID-19 from the BC Centre for Disease Control or the BC Ministry of Health or the Government of Canada, along with information about COVID itself, are information and resources for mental health and well-being. So beyond recognizing the impacts of the COVID-19 pandemic, we wanted to take this a step further and study this in a systematic fashion among patients with rheumatic diseases, including individuals with lupus. This is particularly important because we know that being immunocompromised, individuals with rheumatic diseases are amongst the most vulnerable patient populations during this pandemic. So we conducted what we called the unified study. So our objective was to understand the impacts of the COVID-19 pandemic on patients with rheumatic diseases. And we did this using online surveys. And individuals were eligible if they were 18 years of age or older, have been diagnosed with rheumatic disease and able to communicate in English. And later on, we also translated the questionnaire or the survey in French. So I wanted to talk you through a little bit about the recruitment for the study, which actually we had support from BC Lupus Society. So we did the survey in what we called waves. So we had a baseline survey that we ran from April to June 2020, which pretty much corresponded to the first wave of COVID-19 pandemic. And then we did a follow-up survey from November 2020 to January 2021, which is right around the time of the second wave of the pandemic. So for the baseline survey, we recruited via social media. So using Twitter accounts from myself, our co-investigators, our affiliations like Arthritis Research Canada, and we also, with help from organizations like BC Lupus Society, we also use Facebook communities. So those were all sent and individuals were invited to participate in the baseline survey. So within that survey, we invited individuals, those who were willing to provide their email addresses. And then for the second survey, the follow-up, we directly invited participants through emails. So people would have had to take the baseline survey in order to do the follow-up survey. And then the survey itself was done online, and this is just a screenshot of what it would have looked like. So we designed it so that it would run on a laptop or a computer, but then we designed it so that it could also work on a smartphone or an iPad. So this is the smartphone view of that survey. So we were interested in a whole bunch of outcomes, including mental health. So we were interested in whether individuals were experiencing depression, and by that we mean sadness, loss of interest, loss of energy and fatigue, worthlessness of guilt, and difficulty concentrating. And then we were also interested in anxiety, which is persistent and excessive feelings of fear, worry, and nervousness. And because of like the pandemic and the measures to try to bend the curve of the pandemic, including physical distancing and keeping smaller clusters and minimizing contact, we were also interested in related constructs of social isolation, which is the lack of social connections, and loneliness, which is feelings of being lonely. Sorry, there's a typo there, because we know that these have impacts on depression and anxiety. So I'm just going to fast forward to the results. So again, we collected the survey over 2 waves. So when we first did the baseline survey, we had 718 participants, 75 of them with lupus. And then when we emailed individuals to do a follow-up survey, we had about half complete the survey, so 344, and of those 38 individuals had lupus. So I'm going to be sharing some results, and these are actually coming hot out of the kitchen because we haven't published them. So you will be some of the first to know these findings, particularly the ones that are specific to lupus. So among the people who participated in the baseline, so 75 individuals with lupus, 90% were women, and the median age was 41 years, and we had a range from 21 years to 78. Most of our participants were from Canada, although we did have almost a third from the United States. This was an international survey that we did. In terms of disease severity, almost half of participants had moderate disease severity. And then in terms of how long they've had their diagnosis, a lot of our participants, so 26 or about 35%, had been living with lupus for over 10 years. So now to get to our main outcomes. So at the baseline survey, participants told us, so 54% of participants were experiencing depression, and 45.8% were experiencing anxiety. And then if you look at social isolation, again, at baseline, 28.2% of participants were experiencing social isolation, and 59.7% were experiencing loneliness. So this was at the baseline survey. So if we look at follow-up, in terms of depression and anxiety, the numbers were pretty much the same or similar. So at follow-up, 52.8% of participants were experiencing depression, and 40% were experiencing anxiety. What was striking to us was social isolation and loneliness. The proportion of participants that experienced this or had reported experiencing this at the follow-up were quite increased. So social isolation at follow-up was 41.7%, and for loneliness, it was 69.4%. So I think it really speaks to, the burden and how impactful the measures had been taking. So in terms, when we think about physical distancing, social isolation, keeping to your household bubbles, it really does reflect the sacrifices that people had to do in order to try to bend that curve, particularly, with wave 2 as the pandemic progressed. So these are definitely very striking findings. So aside from experiences with mental health, we also wanted to see what treatment and supports individuals sought. So even though almost half of participants had experienced depression or anxiety, I think one of the signals we found was actually very few actually sought support or help. So 26.8% of participants took medications, and 40% accessed mental health care or support. And the figure here shows who or what type of supports individuals access for mental health. And the biggest proportion, so 50%, sought help from their family doctor. And then you see 30% sought help from a counselor, 20% from social worker. Interestingly, again, in reflection of the COVID-19 pandemic, 76% of these services were delivered virtually, which is a bit of a blessing, in terms of being able to access these services from home, particularly, again, in light of having to physically distance. But then this also speaks the potential of access for individuals who may not have an access to an internet or virtual resources. So altogether, what can we do with these findings? I think it is important, or was important, to be able to do this study specifically for patients with rheumatic diseases and patients with lupus, because it does raise awareness of how much COVID-19 has impacted mental health, particularly when you look participants with lupus, where nearly half experience depression or anxiety. These findings are also important in terms of identifying areas for action. So when we see how much social isolation and loneliness had increased over the course of the pandemic, it really speaks to, what can we do to better support individuals. And this is a potential role for organizations like the BC Lupus Society, and how we can, foster these connections even though we can't be together. And then finally, it's an opportunity to educate and advocate. Really want to raise awareness and let people know how common and how important it is to look at mental health, be aware of mental health, so that individuals will be empowered to seek support for themselves or for their loved ones. So with that, I thank you for joining from wherever you are. I have provided my Twitter handle because I share a lot of my work on Twitter. This is the website for Arthritis Research Canada, and I look forward to questions following this presentation. So thank you.